So this video is going to be a little less fancy and edited and whatever than some of my other ones. It's basically just being done quickly in a response to a question that we get quite often. I've covered in another video, but this one's going to be more specific to just this problem, and that's whenever you give an injection that you have some bleeding afterward and potentially later have like a little bump that could itch or not, either way. So I'm going to cover both of those. First, I'm going to cover the bleeding and then the bumps. Bleeding and bumps. Anyways, so whenever you give yourself an injection, you're putting something through your skin, you have the potential to bleed. Like if anything penetrates your skin, you have the potential to bleed. You have capillaries, veins, and things beneath your skin. So hopefully that's a little bit obvious, but I think that a lot of people just are so excited sometimes whenever they're getting started, they don't think about it. And bleeding after an injection is kind of the luck of the draw. Sometimes you're going to stick and nothing. Great. Sometimes you're going to stick and maybe a drop or two might come out of blood, or just kind of a little clear yellow substance. It's serum, whatever. And sometimes you're going to stick and you're going to hit a fat capillary and that sucker is going to bleed. Those are usually going to be the times whenever we get contacted by people who think they're going to bleed to death. First off, let me tell you, you ain't going to bleed to death from an injection. You're just not. I've been in healthcare now 20 years and haven't seen anything close to that ever happening. Never even heard of it. Same with my husband. He's been in healthcare longer than I have. Never seen it. Never heard of it. It's just not a thing. You're not going to bleed enough through that one little hole to be able to affect your livingness. Now, there are certain special cases if you're on Coumadin or something like that, and you happen to use a huge needle like this size, and you put this enormous hole and you go down, deep enough to hit an artery, which we're not doing that with intramuscular or subcutaneous injections anyway. But like, these are the extremes of things, like, you're on a blood thinner, you're using an enormous needle that's of a length that is completely inappropriate for the shot that you're giving. Anyway, this stuff doesn't happen. If you hear people online saying that it does, methinks that they're spreading myths and fear. Anyways, so under normal circumstances, and let me mention, blood thinner does not mean aspirin. While aspirin can make you bleed like just a little bit more, it's not going to make you bleed to the effect that something like Coumadin or some of the other newer things are going to make you bleed, and these are for people that usually have like atrial fibrillation or, a blood clotting disorder or something like that. This is not something that we normally see, folks on and then having to worry about with hormone therapy. But every now and then there is someone. And if you're on a blood thinner that you're concerned about, just ask. Just ask your healthcare provider, ask me, whatever, if you're concerned. So anyways, back to bleeding after an injection. So it is an expected occurrence. It can happen every single time. It could happen almost never. It's like I said, it's just the luck of the draw, because you're never going to know exactly where your blood vessels are under the skin and which ones are going to be a nice fat capillary, which is going to be too thin to even matter. You're not going to be able to tell this. So don't worry overly much about bleeding after an injection. It's expected. It will stop. If you're very concerned about it, what you can do is, one, hold effective pressure on the site with, a little gauze pad or a paper towel or whatever. Hold it for a solid 2 minutes or more. Do not put it down for 30 seconds and then peek and then, kind of whatever. No, hold firm pressure to the area for at least 2 minutes before you even try to peek, okay? Because what you're doing, if you're not holding it down for that long, is that your platelets don't have enough time to get in place and get a good structure going. So give them time. Firm pressure, 2 minutes or more. Another thing you can do is, if you have a cold pack with some ice or something, you can hold that over the site as well for a couple of minutes. What that's going to do is vasoconstrict those blood vessels that are in there that were bleeding, which will so that they're not as open for spraying the blood. No, they're not going to spray blood anyway. They're not as open for leaking. But anyway, I don't advise that usually, just because it does make it a little bit harder for your platelets to then get to the area as well if you do the vasoconstriction method. But some folks are a little bit overly freaked out about bleeding, and they may want to just hold that cold pack there for 2 to 5 minutes and then kind of let up. But for most purposes, 2 minutes of firm pressure or a little bit more, you're going to be fine. Anyways, so that covers bleeding. Like I said, not a big deal. It may feel like it, and that's valid. That's fine. A lot of people get freaked out by blood, especially their own, but you're not going to die from it. Okay, got it. Okay, so moving on. Sometimes people will get these little bumps after they give themselves an injection. They usually appear within like 1 to 3 days after the injection, and it kind of looks like what would be called as like a hive or a whelp. It looks like kind of like a bump from a mosquito bite maybe, and it may feel a little firm under the skin. It may or may not be itchy. It may or may not have a little bit of pink or red associated with it. Essentially what this is a very small localized allergic reaction. Your body is just simply responding to having been stabbed. You can't expect the body not to react at all whenever you poke something into it. But some people get more of a severe reaction than others to that, which forms these little knots, is what they feel like under the skin. Now, under normal circumstances, that little knot should slowly go away over the course of like 1 to 2 weeks. Sometimes you can speed it up a little bit by taking some Benadryl or something like that 2 or 3 times a day. But what I would advise is, if it is itchy, of course, try to not itch it. You can apply a cold pack or something like that, or just firm pressure so that you avoid actually scratching, because actually scratching it is going to make it worse. Don't play with it. People are always, if there's something on their body that is, not normal for them to have there, they have a tendency to and pick at it. All that's going to do is increase the swelling and or redness to that area, because your body's going to interpret that as you're interested in it and you need to do something about it. And so it's going to send more like white blood cells or whatever to the area to discover what is this that we're playing with anyway. So no playing with the little lumps. Just barely, if you need to touch it, just lightly run your finger over it. Yeah, it's still there. Okay. No need to like grab it or poke it or anything like that. Okay. So normally you'll get one of those every once in a blue moon, but there are some people that get them pretty commonly, and this is a difference here. So pay attention. If you just get them once in a blue moon, whatever, I'm not even going to really think about that, because that can happen with anything. You bump your arm on the wall, or you get scratched or something, you might get some, whatever, it goes away. Those people who get these more commonly and they just keep on coming back, and sometimes like you could have one and it starts going away, and then you give your next injection, that one forms a lump, and then this one gets what we call reactivated and comes back. This can happen with folks that are kind of low-key allergic to the oil that is mixed with the testosterone, which usually it's going to be a type of seed oil, such as cottonseed oil. And if you have a type of allergic reaction to those kind of oils, then you may need to change up the actual testosterone formulation you're using, or get it from a compounding pharmacy that uses a hypoallergenic oil to prevent that reactivation of those sites and prevent those bumps from continuing to form. Sometimes folks can control that a little bit better by taking like 25 or 50 milligrams of Benadryl or some other antihistamine about an hour or so prior to giving themselves their injection, so that it kind of diminishes that response that the body has to the injection immediately after the injection is given. And so that's something you can play around with if taking an antihistamine is okay with you and your general health. I know every now and then I'll run into someone that just absolutely can't take those. But anyway, it's something to consider. Let's see. And then other things to look for, like if you're truly concerned that something could be just off, like why is this happening? Maybe I'm the one that it's happening to because something is wrong, and not because it's just a regular old localized reaction. Definitely look at like the needle size that you're using. Maybe you're using a needle size that is a bit too thick for the injection type that you're giving, such as if you're giving a subcutaneous injection, you really shouldn't be using anything thicker than a 27 gauge if possible. And then, as thin as up to a 30 gauge if you can manage it, because this medicine is so thick, it's hard to push and pull through that, but still. But if you found yourself using, say, I don't know, a 22 or 23 gauge to give a subcutaneous injection, that's quite thick for that, and that's going to be quite irritating giving a subcutaneous injection with a thick needle like that. And then if you're giving an intramuscular injection, which is by far usually the more common injections that are being given with hormone therapy, generally speaking, you would be using anywhere between a 21 and a 25 gauge needle thickness, not length. We're talking about thickness right now, the gauge. And so 21 to 25 gauge is very appropriate, but if you were just crazy pants and you gave yourself a shot with like an 18 gauge, which honestly makes me want to just fall over, but whatever, if you're using a thicker needle and you're getting these bumps, maybe try going to a thinner needle. So if you're using a 21, which is fine for an intramuscular, maybe try a 23 or a 25 and see if you get fewer of those bumps, because maybe you're just a little sensitive to the thickness of the needle. It's more irritating to you personally. Another thing is, of course, check the date of expiration on your medication. You never know. I mean, pharmacies try, but sometimes there will be an expired medicine that's handed out. Then there's also making sure that you are using sterile technique when you're accessing your vial. So, you are cleansing the top of the vial, the little rubber stopper, for a good solid 10 seconds, scrubbing that hub on top with an alcohol wipe, or, rubbing alcohol that's been poured onto a paper towel, something. You're cleaning it really good. And then you're also cleansing the site wherever you're going to stick it, be it your deltoid or the top of your thigh or your glute or whatever. You're also cleaning that area really good with a little alcohol as well. And then you're using a fresh needle every time, because those needles, whenever you take the cap off, the needle itself is considered sterile unless you whack it around on something or set it down on top of, the cat and it runs off and you got to get it and wipe the cat hair off. Don't do that. Hopefully it would be obvious then why you're having problems, but sometimes it's not so obvious to some. So anyways, make sure you are using a good, fresh, sterile needle to access the vial with and pull up your medicine and give the medicine with. And then let's see what else. Make sure you have not been having your medication vial exposed to extreme hot or cold. These vials should not be refrigerated. It can cause crystallization. And if you expose them to heat, generally speaking, it will just denature the medicine so that it will not be as effective, but this could also cause it to cause different reactions with you whenever you give it. So check expiration date, needle size, whether it's been exposed to extreme hot or cold. Generally, you're going to just be keeping this at room temperature, FYI. And, also your technique, are you using good technique? Because if you are doing that thing where some people will hold the needle right here over the skin and then they kind of slowly go like in steps, that's fine if that's the only way you can do it, but do be aware that each time you are doing that, you're increasing the likelihood that you're going to have a reaction or response, because essentially that's like scratch, 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 multiple little scratches going down rather than one smooth straight down. So, check your technique, make sure you're not using too thick of a needle, make sure that it's, sterile technique that you're using to access this. So what is a problem if you have one of those bumps? That's going to be if you see that the bump continues to get larger after just a couple of days. Just staying there isn't so worrisome, but if it continues to get larger and or redder, like I said, it can start off with some pinky red just around mainly just the bump site itself. But if you notice that it begins to spread, that can be more of a reaction. As well as if it starts leaking stuff like, pus or whatever, They may occasionally leak like a little clear fluid. That's not so much to be, concerned about. But if it has color to it, white, yellow, gray, green, that is something you definitely need to report to your healthcare provider so that we can evaluate it and get you treated if it's needing that. But anyways, so keep an eye on those things. Know that getting those little bumps is not the end of the world or anything. Kind of go through that checklist, see is everything here okay. If it's only happening once in a blue moon, like I said, not really such a big deal. It's just your body, checking it out. But if it continues to happen over and over, then that is something you may need to evaluate all those different things and maybe tell your healthcare provider to see if maybe they need to prescribe you a different mix for the testosterone and see if that will help. Anyways, hope this helped everybody to calm down about injections and bleeding, as well as injections and the little bumps that they can cause. Have a nice day. Bye.